you spent quite a long time, haven't you, sort of understanding the needs
Yes.
actually of the market. So you haven't just literally gone, right, I know there's a problem, that's it. I'm going to go, strive towards it. You've actually taken the time to really understand your customer, which is ultimately the local authorities, mainly. But tell us a little bit about that, because I think it's quite interesting.
Yeah, I mean, to be honest with you, when I first came up with the concept, the original version of FullSpektrum was always it was always based on building essentially a personalized LMS. So how we can essentially have content based on any type of topic. You've got core curriculum topics, you've got vocational topics, you've got things in terms of like life skills and how we can deliver it. And then that's when we start to look at the whole concept of well, I receive information one way, another person receives information a different way. How do we understand that? And then once we started to really drill down into all the issues regarding personalized learning, I took the concept and I spoke to a civil servant from DFE, and I pitched the concept to him to see whether if there's any room or there's any type of appetite in the general consensus of education management. And the first thing that they said was key stage 3, send. This is an area that the DFE have been struggling to overcome for many years, despite the changes in the law and the approach to managing this education since 2015 with the SEND code of practice. This is an area that if you could develop a solution that can impact this, not only is there room for impact, but also there's funding. So do that. And that's when we realized, so hold on a second, we can actually look at this. And also, I'm a SEND. I actually come from this background. I've been through the process of having a SEND statement. So why don't we try to map our solution related to my experience and see where the impact is? And then when we started to really research it more and more, it took about 3.5 years to actually assimilate all the information and all the issues based on the ecosystem of SEND in a local and national context. That's when we realized that, there's not one customer. There's actually a myriad of different users and different stakeholders within this, where you have the local authority that acts as the custodian of the funding and the funding support and the provisions implemented based on the child's needs and the outcomes. You have clinical Christian groups formed from NHS that support local authorities based on the health and therapeutic aspects of facilitating the learning development. You also have social care, so any safeguarding or any particular elements based on the child's development, but also their well-being being taken into account. And that's not even touching schools. That's not even touching other elements of learning development in terms of additional support providers, but most importantly, the parent and child. Now, we looked at it for, wow, this is a really multi-level and complex issue. How do we put together a system? How do we put together a solution that satisfies all? Because it's very easy to look at one and to be the best with one and neglect everything else. But then you're still going to have the same issues that they have there. So the first solution that we wanted to put together was essentially like a cognitive screening system. So an app that basically a child can interface with, is able to pick up key attributes of their strengths and weaknesses that can, put a position on what their needs are. And then we said to ourselves, okay, if we did this like a brain training system, what next? You have the information, what do you do with it? Because really and truly, the information that goes to parents are struggling to navigate the current system as it is. So we're not really adding value. How do we add value? The adding of value is the reformation of the framework. And the only way you can do that is to go to the very top, which is local authorities and also policyholders. So we've now got a system that is an MIS. We've looked at in terms of the key issues by the main stakeholders that hold the funding. So rather than look at in terms of, okay, so how do we impact the child and all that, it's about how do we improve workflows? How do we improve the statutory returns that are required from each local authority and multi-academy trust to facilitate the service that's regulated by Ofsted and the Care Quality Commission? How do we look at in terms of any potential cost efficiencies or better management of budgets and personal budgets associated to each education healthcare plan? How do we look at the communication of different stakeholders? How do we, and ensuring that we've got that a better collaborative environment for co-production, assessment and review of EHC plans? And most importantly, how do we get the main person, the child, in the center of it all? Because the Code of Practice 2015 is a fundamental attempt to integrate the service. And it's all meant to be a wraparound, collaborative approach to work with the child. But the child is not put in the middle. The child is the one that dictates in terms of what they need. And most importantly, the information from the child doesn't attribute in terms of how that you can make significant changes and adaptations to the provisions and the support that it needs. And the only way you can do that is in technology. So the FullSpektrum platform effectively migrates and transforms EHC plans from the current standard, which is paper-based documents or PDF files that, you know, case officers will use, Microsoft Word, or various other Word document packages to assemble, and a lot of paper chasing between different stakeholders. So they have to work with a designated clinical officer, with NHS, they've got to work with the SENCO at the school level, work with occupational therapist, an educational psychologist, then report to their superiors. Then once it's all reviewed and fits within the parameters of EHC plan, reviewed with the parent, then executed, then reviewed at least once a year to see whether if the provisions are on track with the outcomes. But the scary thing is, and what we found out from our research is, when it comes to review of these plans, if there's no information based on the outcomes, attainment or progress of the child, nothing happens. There's no background information to relate to the progress of development of their plan, and therefore the funding that can go into a plan. I mean, the EHC plans can go as low as £6,000 per academic year, up to that. I've seen some plans that have been valued at £120,000 per year, based on the complexity of the needs and the support that's needed. But the key elements of managing these budgets and managing in terms of how the child is actually thriving from the support, there's little to no information that's out there. And also the quality of information that goes to these plans sometimes is on borderline ridiculous. There's a documentary that came out with Panorama in the BBC in October, where there was cases where an EHC plan was copy and pasted from one to another. And because essentially the casework was so inundated with cases, I mean, the average caseload for caseworkers is anything from 70 to 200 cases at any given time. So because of sheer load, they looked at the child's initial needs and thought, okay, well, this child has autism or whatever. I'm going to find a representative EHC plan and just copy and paste it. But the child could be a girl, but in the text it references him as a boy. It's ridiculous, and it's really scary in terms of how it's so poorly mismanaged, and also it corresponds to why there's such a massive percentage of these cases that go into local litigation. So you've got some cases that are disputed by parents that have to be mediated by the council, by the advisory services, and in most cases, they become navigated into tribunal cases, where 92% of all EHC plans that were disputed in a tribunal setting were compensated, and in 2019, over £40 million that were not fit for purpose. It's not sustainable.
No.
And systems and structures that are out there are not really addressing the key issues. They only address one thing, which is cutting costs. And that's one of the biggest issues, the reasons why SEND is not an area of major interest in these other companies, but also why there's a lack of innovation and diversification of thought in order to how to make this sector much more accessible, inclusive, measurable, and sustainable.
And in some ways, you can't blame the caseworkers, as you said, because they've got so many cases. But also, if there's no system, as we discussed before, yours is much more like a workflow, case led. And I think that you need to support people. You can't just expect people. It's like tech full stop. If you gave everybody a piece of, a blank piece of paper and said, go and do your job, people would be scratching their heads, and you'd have different variations of quality and what actually the data is about, So, but if you get to the point where everything is, like a system that you've created, it just enables people then to be able to do their jobs with the least amount of manual intervention. But it enables then the rest of their bosses and local authorities and everybody else to fully understand where every single child is, and also potentially with data and with putting some machine learning across it. Then you also get to understand what things work and what doesn't work. If you're working in isolation, you're not learning from other people or other data from what's happening in other places.
We had a conversation with a former head of service. When we had a demonstration of our platform, and to understand from an operational standpoint where the key values could be adhered to. And one of the features we've got on the platform where we can look at in terms of who's been involved in the child's care and the child's intervention, and whether if they've got a particular background in, if they're specialised in dyslexia or ADHD or in eating disorders or anything there. And they said one of the best things that we can do from a managerial standpoint is to do a gap analysis. How competent or how capable each person is compared to the outcomes that are required for the child. People don't think outcomes focused. It's always based on, target focused or procedural focused. It's like with the Right Honourable Robert Halfon, who's a close friend of FullSpektrum and mine as well, as helping us move things along. One of the key things he said in the Fighting for Education Panorama documentary is we normally see the framework process focused. But if the process doesn't work, then how can you expect any type of success or progression everywhere else? Yeah. So our approach has always been based on policy, process, outcomes.
Yeah.
You have to look at that type of hierarchy of development and support so that you can actually look at having a better service. And then if you can actually, if we as a company can provide and will provide a system that can optimize how local services are managed, then we start a gateway of really gearing up innovation. And we can start looking at it in terms of, okay, now we can understand, rather than look at the needs of a child, outcomes of a child, let's look at how they learn. Let's understand what the attributes are, their learning, their emotional intelligence, their temperament, the way that they can actually access information and solve problems, and really start building much more of a broader aspect of their cognitive profile that technology can use to help support decision-making, not just from local authorities, but with educators in terms of how to approach their learning, with head teachers, how to manage their schools and their localized curriculums, with parents in terms of what type of support and investment they need to give to the child. But most importantly, the child themselves, empower them with information. One of the key products that we're going to be building in the coming months is how children can access, information or graphs or data that showcases how well they're doing in real time. So we can show them, we can empower them that if you need to do more, this is how you can do more, and really push them to the boundaries, break those limits, break those ceilings, so they can actually aspire to be the person they want to be. Wow,
no, amazing. So you're managing though a number of different, I suppose, personas, actors, users. I don't know how you might want to take it really, but you've got the child at the centre.
Yeah,
you've got parents that you're also trying to ensure they have the information they need. And they understand what the next steps are. You've got the local authority, schools. So how are you going to make sure you manage all those needs? That's a big.
It's a massive project that we are burdened to to execute, and it's a project where it's multi-phase. So our approach is we've got about 3 to 4 phases in developing what we would think is the most suitable solution for educational reform. The first phase is all focused on developing systems for local authorities that improve the decision support, the management information, analysis, review and co-production of EHC plans. So it prepares them for better outcomes, but also the capability to take on more cases that are needed. And then the next phase is all focused on developing systems for schools and venues of learning, where we're looking at active monitoring. So how we can actually look at the development of the child, the needs, the outcomes, the emotional intelligence, all those things there that can be observed and captured by teaching assistants, teachers, the parents, and also pupils themselves, and how the information can be reported, but also looking at ways of how we can support the commissioning approach to bringing on additional support, additional experience to help the child based on their needs. And then the third phase is then looking at the child themselves. So how do we actually provide some application of self-assessment that not only allows us to gamify assessments that are used to structure their cognition and learning and other needs that are tailored to their neuropsychological capabilities, but also how we use this information to structure personalized intervention and learner support. So if we can actually bridge a gap where, local authorities spend hundreds of thousands of pounds in alternative provision and additional elements of intervention from specialized individuals. But if you were able to digitize it into much more of a digestible content at a fraction of the price, then it means that there's no excuse for all these different capabilities being delivered to each child, and therefore we can start really bridging the gap, not only to build a personalized learning system, but to start structuring key elements of data based on cognitive development that can be used for many different purposes that I can mention. So that's our approach, and it's always based on focusing on one thing at a time and not progressing to the next phase until we have satisfied the accomplishment and deployment of this product. So phase one, we hope to conclude by June of this year. Mm-hmm. And we're looking at piloting our system in between 1 to 3 local authorities and multi-country trusts to understand the capabilities and the outcomes of the system in place, and therefore validate that value add. And once we're able to actually formulate the right solution for the sector, then we'll quickly move on to solutions for schools and other venues of learning.
Amen. I'm really looking forward to seeing some of the outcomes and especially on some of the data what it actually tells us, because I think it's going to be really, really important.